said we are going to have a panel discussion after the next two speakers. Really, what we see here is some of the highlights that these countries, especially most of the speakers are younger, energetic, who are doing the walking, not the talk alone. So really, I appreciate and that sometimes some of us, when you come here, we get the energy from them. So the next speaker is Dr. Suga Yisihak. He is really done something special. I appreciate it because unfortunately I lost my mother to breast cancer. So he has started doing sentinel lymph node biopsy, which preserve help most of our women who are diagnosed with breast cancer. Dr. Suga, please.
Okay, thank you for the organizer. So I will just brief you what are the new things in managing breast cancer patients. So as Dr. Kabada said, we have started doing as it's the first in the country doing sentinel lymph node biopsy. This procedure avoids one of the gravest complications of doing surgery for breast cancer patients. And one of the good things that we have started doing is breast conserving surgery. So I will just go through with some of the pointers. And next slide. Okay. Okay. So I think from the previous speakers, we have seen the data and oh, okay. So just to repeat, the incidence we have seen it repeatedly. So it is very common that now it is a leading cancer in the country, and it is the cancer that we are losing most of our mothers and sisters. And just to show you the numbers, I found this from the internet. So we have like 220,000 new cases in US, and the days is around 40,000. When you see in our country, we have like 16,000 new cases, and the days is almost half of the mothers we are losing because of breast cancer. So the incidence is low, but the days is very much high because we have a lot of factors. And some of the factors that till now we have found is the age factor, because most of our patients are very, very young. We are seeing patients, most patients were in their 40s, but now we are accustomed to find out, so most of our patients are in their 30s. Now even we are treating patients in their 20s. So this is one of the factors. But the most important factor is the presentation. Okay, they present very, very late. So still we are losing because of these factors. But as if this factor is there, but we have some kind of shift because of some activities we are doing, especially in major cities, and especially in October, we have major our awareness raising issue with the media as well as in major hospitals. So very patients are now coming at early stage. So when we call the mothers and sisters to come early, we have to provide them the best treatment that they deserve. So one of the things that we have to prepare ourselves. So with this, so once we have diagnosed patients with breast cancer, we have two options, especially with the surgery. Either we have to remove the whole breast, or we have to conserve the breast. And in order to conserve the breast, we have a lot of skills as well as a lot of gadgets. So with this, just to show you, so whenever, as you all know, we stage breast cancer into 4 stages. So when they come up to 3 stage, the first 3 stage, we can conserve the breast by selecting appropriately. So they compared, till now we have a lot of randomized trials that compare breast conserving surgery with mastectomy about the regarding, especially the survivor benefits. So they showed us there is no benefit by doing mastectomy than breast conserving surgery, as long as we have selected those patients properly. And so I will go through some of the challenges that we are facing to to do breast conserving surgery. The most important one is when we say breast conserving surgery, we will remove part of the tumor. Uh, sorry, with the previous slide, part of the tumor with some normal remove breast tissue, but in mastectomy, we'll remove the whole breast. So in order to have a breast conserving surgery, we need to have radiation setup. So that radiation is the most challenging one. So now we have started doing breast conserving surgery. Still, we have a lot of challenges, but we are using Black Lion Hospital as a platform. They have so they have a separate setup where we call it a private wing. So patients will pay for the radiation and they will get that service. So we are selecting few patients who can afford and they come at very early stage. We are doing this surgery. So one of the most important challenges to have the radiation, and the other most important challenge, as I have said previously, the age of these patients. So you, this, this was well, one of our patients. You can see the age. It is 26, and she was a nurse at our hospital. And so the stage was like stage 2B. So when it is like a mixed one, very aggressive, we tend to go for mastectomy. But for her words were, so she will prefer the breast than her leg. So we have to offer this one. So we have to communicate the Black Line people to arrange us because she can't afford for the radiation. So we have collected some money for the radiation and we did the breast conserving surgery. And the other most challenging stage, still they present, okay, very, very late. Stage 3 is now still the commonest stage. Our patients present, and so radiation is, we have tackled it with the private wing setup. So the other is, so when we call most our women to come early, we are going to face with small masses. When we have small masses, so we are not going to get that mass with palpation. So when we plan for breast conserving surgery in the Western, we have, so there is a wire hook that will localize it with mammograph usually, and it will, they will do the surgery by following this wire. So I have started doing it with the radiologist discussing, we will localize it with a needle, and I will take the patient to the OR with the needle stuck into the mass, and I will remove the mass surrounding the needle. The other is uh, presence of a frozen section setup in St. Paul. One of the good things is it is only in St. Paul is that in the whole country we have a frozen section set up for now. So we have started sentinel lymph node biopsy, as well as we have to confirm the mass that we have removed this from the breast is free of cancer. So all the margins should be confirmed. So when I do surgeries in the St. Paul, I have the privilege of doing the frozen section setup, but in the private wings, almost we don't have that one. So we are waiting the other thing. And the other challenge was the technical issue. So yeah, the one in the middle is Professor Kuhn from Germany, is a very good-hearted physician. Almost he helped us with all his courses. He showed us the techniques as well as the sentinel lymph node biopsy. He came to St. Paul as well as we visited his center in Germany. So the technical issue was resolved by him. So I will not go in details. These are the first 7 cases that I have done in both in the private as well as in St. Paul. This is the nurse I told you, and maybe this one was, you see her age, it is just 23, a newly married, a wife of a physician. She came with the stage was 3B, skin was invaded, but she almost refused. So she equaled her life with the breast. So she will not go any treatment regarding with the surgery. So we have to discuss with the oncologists. We gave her neoadjuvant, and somehow the skin was good, and we did breast conserving surgery. She is now uh, waiting for the radiation. So with the above figures, uh, so most of our patients, from the 7 patients, only we have 1 patient above 52, Otherwise, the others were like early 30s as well as in 20s. And the other issue is the availability of MRI. So MRI in the countries for the breast is only available at one of the private centers in the country, and it will help us to confirm whether that tumor is multifocal or multicentric or a single one. So most of our patients, they don't get that one. So this is one of the things that should be resolved. So this is more of a technical thing, so I will go through it. So this is one of the patients with stage 2A. We'll mark it, and this, you can see the needle. So we don't have the wire, so I just tried to do it with the needle, and it's giving us a good outcome. So this is the methylene blue to do sentinel lymph node biopsies. This technique now has shifted in most of the parts. It needs nuclear medicine and other techniques, but still we have started the earlier ones. So we are getting a good result. So we will remove much of the breast mass. This is the removed mass for that patient. So the other thing is, in one of the centers that I have visited in Germany, they will mark, so the mass is inside, so the margins should be confirmed that they are free of cancer. That is why we need the frozen section. So, but even to mark it, they have a prepared gadget for that one. So we don't have that one, so I have modified it this way. So I will mark it with a stitch, like you can see, 1, 2 stitch, 4, 3. So they will tell me the margin. So we have tackled it this way. So the sentinel, till now, we are very good in finding the sentinel lymph node. We have a very an acceptable range of finding the sentinels, and we have avoided axillary dissection. So, and this is a picture from our patients. This is the final result. So most of after breast conserving surgery, most of the time is going to be taken by the reconstruction, because we will remove almost in quadrantectomy half of the mass. We have to mobilize the breast tissue from the sides, and we have to feel. You can see the end. It looks like more of untouched one. So we have to that one. And this is the nurse I told you after the surgery, and so from our nurse, this was her words, because I told her if the margin was going to be positive, I will do mastectomy. But when she sees the breast after the bandage was off, these were her words. So that means even I don't think we have any complication with the chemotherapy, because she was very relieved, because the most important thing for her was to conserve the breast than the other things. And so now, as I have said previously, most of the studies in the previous days were to compare breast conserving surgery or to do to remove the whole breast. But most studies showed us they have equal outcome. But now the studies are moving forward. So even they are saying breast conserving surgery is superior than even mastectomy. So we have to move. We have to follow the world now. So as a summary, still, I believe it is we have to be in every tract. We have to create awareness so that our patients they will come early. When they come early, we have to prepare to provide them the best treatment options that we have. So we need support in every aspect. So technically as well. So I think it goes with the people to people motto. We have to tackle everything. So and now in the country, like we have like 5 breast surgeons. So we have started fellowship in St. Paul, and in the next 2 to 4 years we will have like 10. So I think we are doing good with respect to the human power, but the other gadgets we need help from everybody. Thank you.
Thank you, Dr. Isaac. Really, it is a very nice achievement. With literary resources, innovation, they are able to make a lot of women happy.